nurse today, and we're going to be performing a head-to-toe assessment. Is that okay with you?
Yeah, that's okay.
Okay, good. I'm going to wash my hands. And do you know why you're here today?
I have a little congestion stuff going on.
Okay, all right. And do you know where you're at?
I'm at GTCC Hospital.
Yes. And do you know who the president is?
Donald Trump.
Good. And do you know the date?
Today is November 14th.
Awesome. Can you tell me your name and date of birth?
Kimberly George, 11/29/1994.
Okay.
At this time, our nurse will be assessing the head.
Alright, Kimberly, I'm just going to take a look at your head and the back of your neck. Looking for lacerations, edema, bruising, skin breakdown, going towards the nape of the neck. Have you had any head trauma or surgeries? Any pain?
No.
Okay. Let me checking for sinuses. Any pain when I'm doing this? Do you have any allergies? Just checking for lymph nodes.
Next, our nurse will be assessing the eyes for cranial nerves 2, optic, 3, oculomotor, 4, trochlear, and 6, abducens.
For this purpose of checking for your vision, I'm going to turn the lights off. Do you wear eyeglasses or contacts?
No, ma'am.
Okay, good. Just look straight ahead for me. Assessing for perla, pupils equal, round, reactive to light and accommodation. Now if you could just look straight ahead. I'm going to put my pen into your field of view, and when you see it, just look for it, okay? Alrighty. And again, I want you to follow the tip of my pen, okay? I'm going to look at your conjunctiva. Good. Alright, if you could just read the letters that you are able to see.
A, D, Z, Y, X, P, N, M, Q.
Alright, thank you.
Our nurse will be assessing the ears, assessing cranial nerve 8.
Alright, I'm just going to take a look in your ears, okay?
Okay.
Do you have any pain in your ears? Any hearing aids?
No, ma'am.
Any drainage?
Mm-mm.
I'm looking at the other one. Any trouble hearing?
Mm-mm.
Okay. If you could, close your eyes. I'm going to test your hearing for you, okay?
Okay.
Let me know when you can hear this, okay?
Okay. I can hear it.
Good.
I can hear it.
Good. Have you had any surgeries?
No, ma'am.
Good.
Next, our nurse will be assessing the nose. Here, she will assess cranial nerve number 1, the olfactory.
Going to take a look in your nose. Any drainage? Any sinus problems? Septum looks center, non-deviated. I'm going to check for your smell.
Okay.
Have you ever had any nose surgeries?
Mm-mm.
Okay, if you could, close your eyes and cover one nostril for me. Let me know what you smell.
Alcohol.
Yes. And if you could, switch.
Alcohol.
Yes.
Next, our nurse will be assessing the mouth. Here, she'll assess cranial nerves 5, trigeminal, 9, glossopharyngeal, and 12, hypoglossal.
Alright, if you could, just clench your mouth for me and smile. Good job. And can you open and say ah?
Ah.
And looking for pink, moist membranes. Any sores? Do you wear dentures? No? Okay.
Next, our nurse will be assessing cranial nerves number 7, facial, and number 10, the vagus.
Alright, if you could, just raise your eyebrows up and down. Good job. And if you could, just swallow. All right, and her speech is clear. I want you to close your eyes and tell me when you can feel this and where.
My right cheek. My left cheek. The tip of my nose. My chin. And my forehead.
Okay.
Here, our nurse is assessing cranial nerves 11 accessory and 12 hypoglossal.
Shrug your shoulders up and down. Good job. And could you stick your tongue out and move it side to side? Good job.
Neck.
Checking for your pulses. Bilaterally. Your lymph nodes. And your trachea. Make sure it's midline. I'm going to put you up at 30 degrees. Look for JVD. No JVD noted. No edema.
Next, our nurse will be assessing heart sounds and all valves.
All right, we'll be assessing your heart sounds. Second intercostal. Aortic. Pulmonic. Erb's point. Tricuspid. Mitral. And apical, which is fifth intercostal, and I'll be listening for a minute.
Next, our nurse will be assessing lung sounds. 6 positions anterior.
Each time I move, take a deep breath.
She'll be listening for advantageous breath sounds to all lobes.
Okay, have you sit up and listen to your back.
Here she will be assessing 8 positions on the posterior.
No adventitious lung sounds, lung expansion, symmetrical, and no labored breathing. Any trouble breathing?
No, ma'am.
Okay.
Next, our nurse will be assessing the gastrointestinal, all 4 quadrants. She will inspect, auscultate, and palpate.
All right. When was your last bowel movement?
Yesterday.
Yesterday. Any pain or rigidity?
Mm-mm.
Okay, is that pattern pretty normal for you?
Yeah.
And what kind of color was it?
It was brown and it was loose.
Brown and loose?
Mm-hmm.
All right. Any nausea or vomiting?
Mm-mm.
Any weight loss or weight gain?
No, ma'am.
Okay. No bruises, lacerations. It's symmetrical. Do you have any surgeries?
Mm-mm.
Okay, and it's concaved.
Starting with the right lower quadrant to right upper quadrant, left upper quadrant, left lower quadrant. Next, you will palpate. Next, our nurse will be assessing the genitourinary section of the patient. Next, our nurse will be assessing the genitourinary section of the patient.
All right. How often do you void a
Um,
day?
I would say probably every few hours.
And that's normal for you?
Yeah.
Can you describe the appearance? the
Yeah,
color?
it's yellow and it's clear and there's no odor or any discharge or anything like that.
Okay, and no urgency or
Mm-mm.
burning.
Mm-mm.
Okay, And your genitals, no drainage or anything abnormal, no edema, looks clean, dry, intact. And are you sexually active?
Yes.
And do you are you using safe precautions?
Yes, I use condoms.
You use condoms. All right.
Next, our nurse will be assessing the upper extremities and inspecting and palpating the sensory and neuro function.
All right, I'm just going to be looking at your arm here, looking for abrasion, skin breakdown, turgor, color, any tenderness or deformities, looking at the IV site for infiltration. It's dry, clean, and intact. Going to check the skin turgor by lifting up, and it's non-tinting. Check your brachials bilaterally. All right, and your radial bilaterally. All right, checking cap refill. And noting the cleanliness of the fingernails. And if you could, squeeze my hands as tight as you can, and push, and pull. Good job. And you just raise your arm straight up. Good. Skin color appropriate for ethnicity, and skin temperature warm.
Next, our nurse will assess the lower extremities and inspect and palpate the sensory and neuro function.
All right, I'm just going to check your femoral artery pulse. Alrighty. Move down to your legs. And how do you ambulate? Do you use a walker or crutches or a cane?
No, I walk independently.
Independently? Good. No abrasion, bruises, lacerations, no edema. Skin temperature is warm, appropriate for ethnicity. Check your popliteal pulses. Okay. And your posterior tibialis bilaterally. And dorsalis pedis. Cat refill. Alright, and I'm going to check your range of motion and flexion. If you could, act like you're driving a car and push and pull. Alright, I'm going to do a little range of motion for you. Lift your leg up. Alright, and you can do the same thing on this side. Good. We also want to check for any skin breakdown. And she looks good.
Next, our nurse will be assessing the posterior of the patient.
Alright, good. Have you roll over. I'm just going to take a look at your back and your buttock. Okay. Just checking for abrasion, bruises, edema, skin breakdown. Looking for the buttocks too for any bruising, abrasion, skin breakdown. Looks good.
Next, our nurse will assess for pain.
Are you in any pain today?
Yeah, I have some chest pain.
Okay, on a scale of 1 to 10, what would you rate that, with 10 being the worst and 1 being the least?
Probably a 6.
A 6, and you said it was in your chest?
Yeah.
And can you describe that for me?
It's a really sharp pain.
Sharp pain?
Yeah, and it gets worse whenever I move around.
When
I
you
just like
move
to
around.
lay around.
When
I
you
just like
move
to
around.
lay still.
Okay. And I'm also going to get your vital signs, okay? We're going to
Okay.
get blood pressure, heart rate, temperature, and respiration.
Blood pressure 133/57, pulse 80, respirations 18, temp 97.9, O2 sat 97% on room air.
Now I'm going to get the vital signs.
Blood pressure 133/75. Next, our nurse will get height and weight. Height 5'5", bed scale weight 150.
Check an IV assessment, clean, dry, intact, no edema, no infiltration. It's a 22 gauge saline locked, the right forearm. And that completes our full head to toe assessment. Thanks.